Good evening. This is All India Radio, Kohima. I'm Jonas Yantan with Evening News. The headlines. All ministers and advisors of Nagaland to contribute 30% of their monthly salaries for 1 year to PM CARES Fund. Total confirmed cases of COVID-19 reported in the country stands at 5,734. Nagaland records negative case. Abhijit Sinha advises citizens planning to return to Nagaland to postpone their return for the time being. And Centre approves COVID-19 emergency response and health system preparedness package. All ministers and advisors of Nagaland have decided to contribute 30% of their monthly salaries for 1 year to the Prime Minister's Citizen Assistance and Relief in Emergency Situations PM CARES Fund starting from April. A press release from the Nagaland Legislative Assembly Secretariat said that a decision was taken in response to the appeal made by Prime Minister Narendra Modi to the nation to contribute generously towards the PM CARES Fund to help fight the distress situation caused by COVID-19 pandemic. The release said that this is besides the 1 month's salary that all the MLAs of the state have contributed to the Nagaland Medical Department in March for supporting the efforts of the state government in dealing with the COVID-19 situation. In a tweet, Chief Minister Nipirio has expressed gratitude to the legislators for their concern and contribution during this time of crisis. A total of 540 fresh confirmed cases of COVID-19 have been reported in the country during the last 24 hours, taking the total number to 5,734. Out of the total cases, 473 patients have recovered and have been discharged from the hospitals, while 166 patients have died. Briefing media in New Delhi today, Joint Secretary, Ministry of Health and Family Welfare, Love Agarwal said, Health Ministry has formed high-level multidisciplinary teams to support the states in ventilator management, containment plan and hospital preparedness. Agarwal said group of ministers, GOM, had a high-level meeting in New Delhi today in which containment, management and setting up of dedicated COVID-19 hospitals and expediting this in coordination with the states were discussed. He said the GOM also discussed a strategy regarding labs and on increasing lab samples in hotspots and clusters. Agarwal informed that supply of PPE and N95 masks and ventilators has also been discussed in the meeting. A total of 69 samples of suspected COVID-19 cases from Nagaland have been sent for testing till today, out of which 65 samples were negative, while the results of the remaining 4 samples are awaited. This was informed by the State Home Commissioner Abhijit Sinha in a briefing on the status update of COVID-19 in the state. Sinha said the state government has ordered for conduct of a magisterial inquiry into the incident involving a medical officer of Civil Hospital Dimapur who was reportedly assaulted on the 3rd April by the police personnel. He said the inquiry officer has been asked to submit a report latest by the 18th of this month. The Home Commissioner also informed that the Chief Minister held a meeting to review the COVID-19 situation in the state and the preparedness of the Health Department. Principal Secretary for Home Abhijit Sinha has advised citizens planning on returning to Nagaland as and when commercial flight services to Dimapur resumes to postpone their return for the time being. In an advisory, Sinha said, for the people whose return is unavoidable will be taken in vehicles arranged by the Nagaland State Transport Department on their arrival at the airport to the institutional quarantine centres designated by the state government in Dimapur for medical screening. It said the returnees will be subjected to 14 days mandatory quarantine at the centre. The advisory further stated that all interstate borders will continue to remain sealed till further orders. This news comes to you from All India Radio, Kohima. The Centre has approved the COVID-19 Emergency Response and Health System Preparedness Package. It is aimed at boosting national and state health systems to support procurement of essential medical equipments and drugs and strengthening of civilians' activities. In a letter to the additional chief secretaries, principal secretaries, and health commissioners of all states and union territories, the Health Ministry said the 100% centrally funded package will be implemented in 3 phases from January this year to March 2024. According to the letter, the Union Health Ministry is releasing funds for states and union territories under the National Health Mission for implementation of Phase 1 up to June 2020. Minister for Higher and Technical Education and Minister in charge for Beren District on COVID-19, Temchen Imnalong, visited Jaluki today for a review meeting with doctors and staff to assess the availability of resources and measures adopted to prevent the spread of COVID-19. The minister was accompanied by Advisor for Water Resource Department, Namri Inchang. Imnalong extended gratitude to the medical fraternity of the district for their sacrifice and appealed to the people to extend cooperation to the frontline workers in battling the pandemic. He urged the medical staff to create more awareness in the district about the preventive measures against the deadly virus at a grassroots level. The minister also visited the isolation ward and inspected the personal protective equipment supplied to the district. Nagaland government has released a new version of self-declaration and COVID-19 Nagaland app, which can be downloaded from the website nagahealth.nagaland.gov.in. The government has directed health officials to ensure that all those who have been put under home quarantine to download the app in their smartphones and complete the registration process. Those who are not in possession of a smartphone has been asked to seek the support of the ASHA or school teacher or any other person in possession of smartphone for self-declaration in case of having symptoms through community reporting. All persons should update the health status daily in the app using Home Quarantine tab to answer phone calls from control room or the surveillance team. The people under home quarantine have also been asked to cooperate with the surveillance team during home visits and to strictly follow the guidelines on home quarantine. Principal Director of Health and Family Welfare has informed that any act of non-compliance will be deemed to have committed an offence punishable as per the provisions of the Epidemic Disease Act 1897. Kohima District Administration is tirelessly working in distributing relief materials to the stranded students, migrant workers, and the needy people like the daily wagers, old age home, orphanage, differently abled persons, and pregnant women. Since the commencement of Kohima Relief Distribution Center on March 30, the administration has so far distributed essentials to about 13,000 people till yesterday in the first phase. Besides the essentials supplied to the colonies and wards, approximately 1,000 relief packets are distributed every day from the center from 9 a.m. to 7 p.m. The administration has also been receiving calls through the district control room, unions and state bhavans for assistance. The administration has also made provision for home deliveries to stranded students who are unable to collect the relief packets, which is distributed by the volunteers of Nehru Yuva Kendra, Sangatan, NKY, Kohima, and Angami Youth Organization. It is also reported that even after delivery at certain locations, the stranded students sometimes refuse to collect the packages. Meanwhile, many churches, unions and laborers working under various contractors are coming for availing the relief, which is not the primary purpose of the relief exercise. At present, the district administration is jointly working with the State Disaster Response Force, District Disaster Management Authority, NYK, PSF, CRPF, and PRTF. Many organizations and NGOs are also extending help, both financially and materially. Despite facing various challenges, the administration, along with various departments, are zealously working in providing the basic needs of the people at a time of the lockdown due to COVID-19 pandemic. And now it's 20 news. Here are the main points again. All ministers and advisors of Nagaland to contribute 30% of their monthly salaries for 1 year to PM CARES Fund. Total confirmed cases of COVID-19 reported in the country at 5,734. Nagaland records negative case. Abhijit Sinha advises citizens planning to return to Nagaland to postpone their return for the time being. And Centre approves COVID-19 emergency response and health system preparedness package. That is all we have in this evening news bulletin. Good night.